You're probably wondering at this point why OCD doesn't work in the long term, right? We've talked a lot about how the mind tells people with OCD to engage in certain compulsions in order to relieve their anxiety and in order to prevent feared outcomes from happening. And they work. And that's the problem here, right? And so they work in the temporary. When you do engage in a compulsion, there is a great deal of reduction in anxiety or any type of distress, whether that be guilt, shame, fear, anger, frustration, irritability. And so, whenever you have a reduction in uncomfortable sensation following the completion or performance of a behavior, it naturally reinforces the need to engage in that behavior in the future. And that's what's known as negative reinforcement. We're going to talk a little bit about that in a minute. But to better explain the reason why OCD doesn't work in the long term, we clinicians use what's known as the cognitive behavioral model. And the cognitive behavioral model of OCD looks like this. And as you can see here, there's always a trigger, okay? And a trigger can be a situation, it can be an event, or it can also be the obsession itself that pops into one's mind. And that's the starting point of the model. And so if you think back to when we were talking about germ contamination, the trigger for germ contamination would be touching an item that one perceives to be contaminated. And so for myself, right, if I had germ contamination OCD and I went to go touch a doorknob could be a trigger for this obsessive belief or intrusive thought that there's dirt or germs on the door handle and that I'm going to get sick and die. Okay. And so I could ask you, if you touched a door handle and this thought popped into your mind that there's physical contaminants on it and that you're going to get sick and die, would you feel anxious? And I think for most people, they would say, of course I would, right? I mean, I would feel uncomfortable. And so the reality, though, is, right, that the person's obsessive belief about the door is out of proportion to the actual risk that's present. And so most of us touch door handles throughout the day and we don't think twice about it. Now, right, given COVID, we are. And that's kind of interesting in itself. And so many of us have a window in to what it looks like for OCD. And so, again, right, coming back, situations touching the door handle, obsessive belief or intrusive thought is, what if I get sick and die? And then anxiety starts to mount, right? It starts to climb. And as one becomes more and more distressed, there's this. There's the urge to control or get rid of anxiety and the urge to prevent that thought of worry from happening. And so as you're starting to feel anxious, your mind starts to get creative and it says, well, in order to ensure that you don't get sick, in order to get rid of this level of distress or anxiety, you need to wash your hands. But you don't just need to wash them one time, you need to wash them repeatedly. So now it says, well, you have to use an excessive amount of soap. You need to use 5 pumps of soap instead of 1. You need to wash your hands in a very particular order, starting with your palms, moving to the outside of your hand. Okay. And then maybe you finish washing and that thought pops in, but what if I'm not clean enough? And then you need to restart the process again. Okay. And so as this individual washes their hands, there is this temporary reduction in anxiety, right? There is relief. And then what happens is, right, you feel better, okay? Until what happens next, though? Until you come in contact with the door handle again, okay? And so compulsions work in the short term to reduce anxiety, okay? But then the next time you encounter a situation that makes you anxious, it says, well, last time you had this thought that you were going to get sick, last time you touched this door handle, you washed your hands and you did it in this particular way and used this amount of soap and you felt better and you didn't get sick. And therefore you need to do it again in the future.